Welcome to the third module, Risk Adjustment Provider Perspective, from Chapter 1 of Unit 1. This course has been designed to be a review course to help prepare you to take the CRC, the Certified Risk Coder Certification exam from the OPC. Hello everyone. I'm Emily Taylor, the Chief Medical Coding Instructor. In the previous modules, we discussed coding profession, the opportunities and challenges in risk adjustment from a payer's perspective, and the record retrieval and record review process. In this module, we will define the impact of risk adjustment in an outpatient setting, and describe the role of a professional coder in an outpatient setting. As in an inpatient setting, where a coder focuses on ICD-10-CM and ICD-10-PCS codes, providers in outpatient settings are paid on CPT coding or the level of evaluation and management service, where the focus is not on diagnosis codes. Therefore, a provider has to stay informed on changes in guidelines and codes. Since risk adjustment financially influences health plans, providers need to correctly portray the acute conditions of their patients. In a value-based reimbursement environment, accurate diagnosis documentation and coding ensures that providers are paid accurately for the care they provide. Value-based reimbursement aims at paying providers more, to spend additional time with sicker patients, than the 15-minute time slot allotted for every patient, regardless of their health status. Plans make risk adjustment medical record requests for Medicare Advantage RADV audits and HHS RADV audits. The Medicare Advantage RADV audits are carried out on a small number of randomly selected health plans, and the HHS or commercial RADV is likely to happen every year, for every plan. This will result in many more record requests in a short time to meet tight RADV timelines, which requires additional resources such as time and staff. Other quality initiatives programs crucial to a health plan's success and also raise record requests include HEDIS, Medicare Stars, and state-level programs. Nearly all providers' electronic medical record systems and workflows were created and maintained to be used in a fee-for-service environment. Fee-for-service methodology is followed to pay providers employed by larger organizations. Though fee-for-service payment model focuses on CPT codes, ICD-10 codes are considered to support medical necessity for the services being provided. While electronic medical records ensure legibility and that documentation requirements are met efficiently, they are challenging in the sense that all submitted codes for an encounter must be supported in the documentation, with all necessary information for audit request. Hence, to check with EMR, clearinghouses, and other vendors to ensure that a practice can submit up to 12 diagnosis codes per claim, becomes crucial, as generally systems cut down the number of diagnoses submitted without the provider's knowledge, leading to an incomplete clinical picture for the patient. As per the ICD-10-CM guidelines, providers are instructed to code all documented conditions that coexist at the time of the encounter or visit, and that require or affect patient care, treatment or management. With the increased focus on risk adjustment coding, CMS has increased its audit analysis. The provider uses the lists available in their EMR and choose their own codes for care. A certified risk adjustment coder is not only familiar with the cause and effect of some conditions that ICD-10-CM allows, but also keeps up with the changes to ICD-10-CM and brings necessary changes to office procedures and workflows. A professional coder in the outpatient provider setting plays a significant role. A coder can ensure the claims submitted match the documentation in the medical record. They can help in applying the various coding guidelines laid out by ICD-10-CM and CPT to the medical records they review. They may be able to offer assistance to ensure the doctor is updating the various lists in the EMR. The professional coder can also internally audit to ensure accurate assignment of diagnosis codes and give feedback for any inconsistencies in coding. Certified coders can work with the reports that are supplied by insurance companies to identify patients who appear to have a gap in care based on previously set policies within the practice. One effective way a coder can assist a provider is by providing a note or task on the provider's screen so that the provider is aware of the information needed. This allows the clinician to focus attention on patient care with minimal distraction. This brings us to the end of Module 3 from Chapter 1 of Unit 1. In this module, we defined impact of risk adjustment in outpatient setting, infrastructural arrangements, and finally described the role of a professional coder in outpatient setting.